Welcome to Trump Breaking News Network, your daily source for up-to-date news on the political scene of Donald Trump, his presidency, American politics and conspiracies. Please subscribe to receive notice of our daily updates. Also share with your friends and your social media. We encourage you to like our videos and give your comments.
This is TBNN.
Food stamp enrollment drops by 4 million in 1 month. 4 million people dropped off the food stamp rolls in 1 month, according to the latest numbers on food stamp enrollment from the U.S. Department of Agriculture, USDA. The latest USDA data show that the number of participants in the Supplemental Nutrition Assistance Program, SNAP, the government program that administers food stamps, dropped from 45,666,795 in October 2017 to 41,658,868 in November 2017, a staggering decrease of 4,007,927 over 1 month. Even though there was a temporary spike in enrollment, mostly concentrated in a few states that caused the national average of food stamp enrollment to spike, nationwide enrollment in the program as a whole is still on a steady decline. Enrollment in the program sharply increased by 3.5 million during the first month of fiscal year, FY 2018, October 2017, mostly due to heavy increases in temporary SNAP enrollment in hurricane-affected states such as Florida and Texas. Indiana became the second state to implement work requirements for Medicaid on Friday after the Trump administration approved their waiver. The Donald Trump administration approved a waiver for Indiana to implement work requirements for the Healthy Indiana Plan, HIP, which provides Indians health insurance. The waiver will also include a tobacco surcharge and up to $240 million over 3 years for addiction treatment. Indiana now requires HIP recipients in community engagement activities, which includes going to school, participating in a job training program, working, or volunteering. Alex Azar, the new Health and Human Services, HHS, Secretary, said in a statement, "Today's announcement is one significant step in a long legacy of innovation in person-centered health care. Indiana's vision and ours goes beyond the provision of quality health care. It recognizes that Medicaid can become a pathway out of poverty." Kentucky received the green light Friday to require many of its Medicaid recipients to work in order to receive coverage. The Bluegrass state thus becomes the first state to act on the Trump administration's unprecedented change that could affect millions of low-income people receiving benefits. Under the new rule, adults aged 19 to 64 must complete 80 hours of community engagement per month to keep their care. That includes working a job, going to school, taking a job training course or volunteering. There is dignity associated with earning the value of something that you receive, Kentucky Governor Matt Bevine said. The vast majority of men and women, able-bodied men and women, they want the dignity associated with being able to earn and have engagement.
This has been the Trump Breaking News Network. Please subscribe and share to stay up to date on the latest news about our president. Be informed.